Psychological distress and respiratory disease, part 2. In this video, I'm going to discuss how we can reduce the barriers of psychological distress in patients with chronic respiratory disease. Hello, and welcome to Lung Mind channel. If you're new to this channel, I'm Ms. Devi Sundar, founder of Teletherapies. I specialize in pulmonary rehab, counseling, and psychotherapy. For the past 21 years, I have specialized in treating chronic respiratory disease conditions alongside with their emotional challenges, what the patients undergo, like anxiety, depression, panic, and self-esteem. I'm more involved in the behavior change practices in the pulmonary rehabilitation, and also now I'm practicing my psychotherapy alongside for general conditions. This Lung Mind channel is focused in delivering educational resources to empower both the patients and the professionals. If you have not watched my previous part in psychological distress and respiratory disease, I would recommend you to watch that before you could enter in this video. Without any further ado, I'm going to jump into this video. In this video, I'm going to discuss about how to reduce the barriers of psychological distress in chronic respiratory disease. Health beliefs and health behavior changes are interconnected concepts that plays an important role in promoting individual and community health. Health belief refers to personal perceptions, attitudes, and understanding an individual holds about their illnesses and their healthcare systems and about their health. These beliefs are influenced by various factors, including their cultural, social, economic, and personal experiences. Whereas, on the other hand, health behavior change involves modifying and changing those behaviors to promote health and prevent illnesses. It's often driven by individuals' perception or the beliefs about their health, as well as the external factors like their society where they live in, the healthcare practices in the society, and the level of literacy and the health education. Perception of illness plays a significant role in psychological distress. Patients with chronic respiratory disease may develop negative beliefs about their condition, anticipate worsening effects from their illnesses, experience fear and worry about their breathlessness, dependency on the oxygen, physical limitation, changes in their appearance, or exacerbations, which might be as a frequent episode in one's life with chronic respiratory disease, and this can impact very badly their self-esteem and their self-perception. Psychological theories and models such as health belief model and trans-theoretical model of behavior change apply to the respiratory disease to understand how an individual perceives their condition, they perceive benefits, the barriers to behavior change, their stage of readiness to make a positive health behavior change. And these information will help a healthcare professional to understand the needs of the patient and the interventions they can tailor to support the individual in making a sustainable change to manage the respiratory conditions effectively. Earlier, I mentioned about the health belief model and the trans-theoretical model. Let me now explain it more clearly. The health belief model suggests that the individual's readiness to take action to prevent or treat their condition is influenced, particularly the health condition, is influenced by the perceived susceptibility, the perceived severity, perceived benefits, perceived barriers, the cues to action, and their self-efficacy. Whereas the trans-theoretical model is also known as the stages of change model, where it proposes an individual goes through different stages when trying to modify a behavior. The initial stage is a stage of pre-contemplation, and then contemplation, preparation, action, and then maintenance. Pulmonary rehabilitation is a gold standard intervention for treatment or management of chronic respiratory disease. And it has many researchers been confirming that pulmonary rehabilitation improves patients' physical endurance, exercise capacity, and their quality of life. And now the researchers for the past decade are evolving around the psychological and social support in patients having chronic respiratory disease, and pulmonary rehabilitation being the biopsychosocial model involving these components together is delivered in a package to patients with chronic respiratory disease. So what are the theories that is applicable to the biopsychosocial model of the pulmonary rehabilitation, in addition to the health belief and the stages of changes theory? The other theories that is applicable are the social cognitive theory. This theory emphasizes the role of self-efficacy, the observational learning, and social influences in behavior change. It suggests that the individual learn and adapt a new behavior through observation of others and by assessing their own capabilities to perform those behaviors. And this is why pulmonary rehabilitation in most settings is offered in a group exercise program or a group educational program. Actually helps the individual to model the behaviors observed from other people. And the other theory that's applicable is theory of planned behavior. This theory it suggests that the individual intention to engage in a behavior is influenced by their attitudes towards their behavior, the subjective norms that they perceive social pressure, and they perceive behavioral control. Let me now list down the strategies to promote health behavior change in chronic respiratory disease. Most of these strategies are delivered in pulmonary rehabilitation setting, so I'm just going to discuss all those strategies. The first one is health education and skills training. It mainly focuses on providing accurate and accessible information about the benefits of adopting a healthy behavior to increase awareness and motivate individuals to practice the change. The second is social support. It's about creating a supportive environment, both for the family and the individuals, to facilitate a behavior change, a sustainable new habit. And third is self-monitoring, encouraging individuals to track their behaviors, such as using a diary to track their smoking habits, their food, their inhaler medication regimen, and using a fitness tracker to track their physical activity so that it creates a sense of accountability for their own health. And fourth is goal setting. Setting realistic and specific goals will help individuals to keep motivated and engaged in their behavior change actions. And once they reach a milestone, rewarding those behavior will help them to have a continued motivation in their new habits and trying to adhere to that for a long term. And the fifth is the environment modification, making changes to the physical environment, like creating a smoke-free area or promoting access to the healthy food wherever they go, and that can support their behavior change. And the sixth is incentives and rewards. Offering an incentive or rewards for achieving the behavior change, as I mentioned earlier in the goal setting, can help them keep focused and their behavior change activities. And the seventh is about tailoring interventions, like recognizing the individuals have different health beliefs and their needs and preferences. Intervention should be personalized to their needs and also culturally sensitive, because the cultural beliefs also plays a huge role in keeping up the motivation levels of the individuals in their planned behavior change activities. The second barrier in patients with chronic respiratory disease that causes their psychological distress is health communication and patient-provider relationship. Effective communication between the healthcare providers and the individuals with respiratory disease is very important for treatment regimen planning and shared decision making and patient satisfaction. This will greatly benefit the improved outcomes what the patient can perceive in the long term. The psychology and behavior science inform strategies to enhance the patient-provider communication. The third tip to reduce the barriers for psychological distress in chronic respiratory disease is implementing some stress management and relaxation technique. Why to use these techniques? It is very clearly evident that patients with chronic respiratory disease have anxiety, depression, and panic attacks or post-traumatic stress disorder. And psychological interventions can help them to improve their anxiety, depression symptoms and help them to regulate their emotions and improve their self-esteem and self-perception. Thereby, that is going to impact on a positive, improved outcomes in patients' quality of life. Fourth tip to reduce the barriers, psychological distress in chronic respiratory disease is to improve support and coping strategies in pulmonary rehabilitation setting. The behavioral science and psychological interventions provided to individuals with chronic respiratory disease should include some tools and techniques to cope and challenge their negative belief systems about their illnesses or about the outcomes from the illnesses. This can be done done by providing some emotional support and counseling support to the carers of the patients, their friends, and also to link the patients to other social support networks in their local community, which can impact directly on their feeling of connected to the community and reduce the feeling of isolation and improved belongingness to community as a whole can impact positively on their quality of life. By integrating the psychology and behavior science into the respiratory disease management, healthcare providers can offer a comprehensive care that not only addresses the physical symptoms of those patients, but also the psychological, emotional, and the behavioral factors that can hugely have a greater positive impact on their outcome. Hereby, I'm actually concluding by saying that we need to approach pulmonary rehabilitation and the care management for chronic respiratory disease in a holistic way so that it can have an overall integrated component of physical and social and emotional well-being in those patients. I hope this video was helpful. If you believe this video was helpful and informative, please do click that like and subscribe button and do share with your friends and network. Thanks for watching. See you in the next video.